Hi, I'm Cara Nunez.
And I'm Uhlrich, and today we're going to talk about how reducing the activation of the gastrocnemius muscle can reduce the loading in the knee joint. Osteoarthritis is the second leading cause of years lost to disability in America. As a result, there is a large effort to come up with conservative interventions that can slow the progression of the disease. One way to do this is to reduce the forces in the affected joint. In this project, we focus specifically on the compressive forces in the knee. Matt Demers and others published a simulation study that estimated how the recruitment of individual muscles affects the loading in the knee during walking. A main finding of this study is that reducing gastrocnemius recruitment and increasing soleus recruitment reduces late stance knee loads. This can be seen as the reduction from the black to the green line in the right-hand half of the plot. We sought to reproduce this result experimentally and investigate if walking with gastrocnemius avoidance gait reduces knee loads. During our experiment, we recorded electromyography, or EMG, from 12 different muscles on the right leg and collected marker data from both legs as well as the torso. Our subject walked on a force-instrumented treadmill while receiving real-time visual feedback of raw EMG signals of both the gastrocnemius and soleus muscles. He was instructed to alter the ratio between the signal magnitude of his gastroc and soleus muscles. After capturing several minutes of walking, we were able to select 2 gait cycles representing lower gastroc activation, or what we'll call gastroc avoidance gait, and higher gastroc activation.
As Scott just mentioned, we analyzed 2 extreme cases of gait, more gastroc activity and gastroc avoidance. These plots display filtered EMG signals normalized to a maximum contraction trial for both cases. Compared to the more gastroc case on the left, the gastroc avoidance case shows much less activation of the gastroc, shown in black, in comparison to the soleus, shown in blue. It is also important to note the lack of vasti, shown in red, in both cases. We anticipated there would be more activation of the quads during gait, and kept this in mind when analyzing our results in future plots. Once we collected our EMG data, we needed to decide how to best incorporate it into our simulation. Initially, we intended to use EMG to constrain the static optimization, or CMC, muscle redundancy solvers in OpenSim. This approach would have given us experimentally consistent joint moments. However, since we collected EMG data from 12 different muscles, we could be over-constraining the system. Additionally, we would not be able to validate our results. Thus, we looked into completing an EMG-driven forward dynamics simulation, as we would be able to validate our results by comparing the joint moments from the forward dynamics simulation to the joint moments from inverse dynamics. The downside to this analysis is that the joint moments will not match perfectly. Although they will not match exactly, we believe that they will match sufficiently for the scope of this project, and that we can also complete parameter optimization to improve how well they match if necessary. Thus, we decided to complete an EMG-driven forward dynamics simulation. We used our normalized EMG data and prescribed motion from inverse kinematics as our inputs to the forward dynamics simulation and obtained tibiofemoral force as the output. Then we ran inverse dynamics with marker data and force data as our inputs and obtained joint moments as the output. We then compared the joint moments from inverse dynamics to the joint moments from forward dynamics. Here is our OpenSim model after completing forward dynamics. Only the right leg contains muscles since the left leg is not on the ground when the peak tibiofemoral force occurs, which is what we will be looking at for our analysis. The muscles are changing color based off of the activations from the normalized EMGs that we fed into the forward dynamics simulation. The general kinematics and muscle activation matches what we would anticipate for a typical gait, with the noted exception of a lack of vasti activation. Before looking at the knee loads, we must check that our model is valid based on the joint moments. The ankle moments match relatively well in terms of shape and scaling, especially in late stance. The right knee moment does not match as well, which was expected due to the fact that there are many more muscles that cross the knee than the ankle, and we did not measure all of these muscles. However, the general trend and shape is similar, and the plots match much better in late stance. We would like to note the lack of a knee extension moment in early stance in the forward dynamics simulation compared to inverse dynamics. We believe this occurred because of the lack of vasti activation that we pointed out previously in our EMG plots. Although this is noticeably different from what we would expect in early stance, our investigation focuses on late stance knee loads, where we have more confidence in the validity of our results.
Using the joint reaction analysis tool in OpenSim, We computed the compressive force in the knee during the stance phase from our forward dynamic simulations of the more gastroc case in black and the gastroc avoidance case in green. Similar to Demers, we did observe smaller tibiofemoral forces during late stance in the gastroc avoidance case compared to the more gastroc case. The magnitude and shape of the gastroc avoidance profile does match the Demers results. However, the early stance forces in the more gastroc case did not follow the expected two-peak profile of knee loads during stance and even dropped below one body weight during early stance. These low contact forces and the lack of an early stance extension moment indicate an underrepresentation of quadriceps force in our forward dynamic simulations. Our future work would be focused on improving this issue first by improving EMG placement and normalization techniques. To further improve the agreement and joint moments, we could hand-tune or use parameter optimization to tune the variables associated with converting EMG to control inputs, as well as other model characteristics. Finally, we'd like to focus on improving the real-time feedback system so we can train subjects to walk with steady-state gastroc avoidance gait. We could then compare average knee loads from gastroc avoidance gait to average knee loads during normal gait to better understand the clinical potential for this intervention. We'd like to thank Jenny Young, James Dunn, AJ Seth, and Scott Delt for their methodological and technical support on this project, as well as other members of the Stanford Neuromuscular Biomechanics Lab for their assistance.